deferred, and these are the reasons I set out. As a consultee on the planning application, our concern relates to an unresolved health care Section 106, which is needed to mitigate the impacts of the development on local primary, community, mental health and acute healthcare services and ambulance services, as I mentioned. The acute matter has additionally been raised separately by Princess Alexandra Hospital, PH for short, which also falls under our remit. Our position on the application is set out in our letter dated 24th of February, which you have acknowledged in the pack, and thank you. Having to address this important matter so late in the day, in this way, was not our preference. But unfortunately, officers have been unable to meet us until recently, which was last Thursday. Too little, too late. We therefore find ourselves in an unfortunate position where no acute care contribution is being offered or supported. This is in despite of the submission of consultation and supplementary responses, supported by our unchallenged NHS health impact assessments, additionally used to inform the authorities, the infrastructure IDP, for the wider Garden community. For the health centre, the council and the applicant have decided, without any consultation with us at all, that service land will be provided, the applicant will develop it, and in return, the ICB will have the privilege of paying a market rent with annual RPI upward only inflationary rent reviews. This is not acceptable to the ICB or the patients that we represent. As our letter of the 24th of February 23 sets out, what will make this development acceptable is suitable, sufficient, service land at nil value, and for the financial contribution to be paid to us, the ICB, the Commissioner of Healthcare Services, to determine its own procurement and delivery route. Provision for an ambulance service contribution also needs to be made, as previously identified. For acute care at the overstretched PH Hospital, the level of local impact generated by this large housing development should not be in dispute, although we understand there is a difference of opinion on how household populations are accounted for and how funding shortfall arrangements are justified in the Section 106 context. Officers consider Section 106 funding meets the SIL tests for healthcare, but for the primary and mental health, but not for acute care. Although advice from leading counsel on the acute care suggests otherwise. This situation therefore needs to be bottomed out before approval is given to avoid any potential challenge and delay, and hence our request this application is deferred. We really hope, Chairman, that members will lend their support to resolving the outstanding healthcare situation in favour of suitable development contributions. This would help to ensure sustainable development is delivered at Gilston and allow us to remove our holding objection. We remain very much open to discuss the matter with your officers and the applicant. It is therefore requested that if the application is not deferred, any resolution to grant permission should be on the basis that a suitable Section 106 primary, acute healthcare and ambulance contribution is agreed between all parties and brought back before committee. Thank you.